Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about prenatal vitamins, specifically the prescription ones. Now, every time I have a new patient that comes in that's pregnant, I'll always ask them if they're on a prenatal vitamin, and sometimes and then I'll ask if it's prescription or over the counter, and I get the impression some of them feel guilty when they are on an over-the-counter prenatal versus a prescription. And we're going to go over why there should be no feelings of guilt whatsoever with that. Before I do, however, make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel. That being said, the whole concept of prenatal vitamins, specifically prescription prenatal vitamins, started with the whole identification of the methylene tetrahydrofolate reductase, MTHFR, the SNP, the genetic uniqueness that some people require more folic acid to make the active form, and that the women who have that SNP are more likely to have neural tube defects. So the idea was, well, we'll just load them up with folic acid and we'll reduce the chance of a neural tube defect. And it turns out like that's true, that does work. However, these prescription prenatal vitamins, like that's all they are. They're many times 1 gram of folic acid, which requires a prescription. If it was $999, it wouldn't be a prescription. Instead, it's 1 gram, and so so now it's a prescription. And some of these, like as an example, the citranatal, the Citra family is prescriptions on Amazon. This can run on Amazon Pharmacy like $128 for a month. Like this should be a phenomenal drop down, amazing multivitamin that should make my hair grow even though I'm not pregnant. So let's get into this particular study, and it was done out of China. It looked at 172 pregnant women with gestational diabetes mellitus, so they developed diabetes during pregnancy, and compared it to 172 women who didn't. Specifically, they looked at a couple different factors. One was the 5-methyl tetrahydrofolate, so how much of this activated folic acid do they have? How much B12 did they have in their bloodstream, and other methylation markers like homocysteine and transholobimin. So one of the other markers of homocysteine. But what was interesting is that when the serum methylene tetrahydrofolate, the folate levels were higher, especially in early pregnancy, those women had 2 times the risk of developing gestational diabetes. On the flip side, if their B12 was higher, they had 67% lower risk of developing gestational diabetes. And the couple things to mention. First of all, this is also a dietary factor. It's not just about folic acid and B12 and how those play a role. A lot of everything we think about for diabetes also plays a role for gestational diabetes. The other thing that is not usually explained is that if you have gestational diabetes, you are at massive increased risk of developing diabetes in the future. So it means that you have a very strong tendency towards diabetes, and you need to be very conscientious with the rest of your life. So here's the problem. None of these prescription prenatal vitamins contain B12. They contain crappy iron, but luckily they contain a stool softener to balance out the constipation from the poor quality iron, because you won't absorb it, it'll just cause constipation. But no B12 in any of these citranatal products, which would suggest that these products may actually contribute to gestational diabetes. $128 a month for a crappy prenatal vitamin. Make sure you label read. You want to make sure that your prenatal vitamin should look like a very broad spectrum. A lot of them have thrown in DHA and probiotics and things like that over the years, but we really want a prenatal vitamin to contain all of the B vitamins, not just folic acid, so it meets the criteria for a prescription, and you can now charge 20 times what that multivitamin is worth. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.